President Obama taking too much of a hands-off approach with Iran? Radio talk show host Rush Limbaugh says he's figured a way for the president to actually denounce the violence and remain diplomatic. Listen to this.
I have figured out a way. I got a brilliant idea here. Finally get a way for Obama to speak out against the regime in Iran. A way for Obama to denounce what's going on. To simply call Iran the Fox News channel. If we call Iran the Fox News channel, Obama will be denouncing it every day, multiple times a day.
So does Rush have the right idea? In the pundit pit today, former Senate Majority Leader Dr. Bill Frist is in the house. Also, former Lieutenant Governor of New York, Betsy McCoy, and former pollster for President Clinton, Bernard Whitman. Good morning to all of you.
Good morning.
Good morning. Senator, let's start with you. So far, the president, he waited 3 days before he said, okay, we're just going to let the dialogue go. We're not going to meddle. But Rush says, if they change it to the Fox News channel, he'd be talking about it all the time.
Way too slow. Way too slow. The president should have been out there. He should have looked at the system. He can condemn the system without taking sides. He's playing it right down the middle. And, that's his real art, and that is to make everybody feel like he's talking to them. But there have to be certain lines. So I would push him much more aggressively in the direction of condemning this overall process.
Bernard, your guy needs to do more, according to the senator.
Well, look, I think the last thing we want to do in a situation as volatile and fluid as this is get way out in front. Obviously, the last thing we want to do is have the regime be able to paint the protesters as being somehow toadies or stools of the U.S.
What's going on in the streets? Don't we support the fact, this looks more like democracy than whatever they've got operating right now with the mullahs.
I think we can absolutely support the demonstrators without being wildly out in front and potentially inflaming the situation on the ground.
Betsy?
Restraint was appropriate at the beginning, perhaps, but for the president to suggest that Ahmadinejad and Mousavi are almost the same is tone deaf to liberty. To see mothers and students reaching out to the West in English with their new American-style technology, sure. Facebook, Twitter, cell phones, it's very moving to us. We know this is our kind of freedom.
And in fact, Senator, your side, the Republicans are saying, let's support the protesters, the demonstrators.
Well, I think it's the protesters. Mousavi, I don't know about or not, but we need to support the democratic process itself. We've got Europe way out in front of where we are today in terms of condemning the process itself. And let's support democracy. That's something we can put up there and make it shine.
All right. It's great to have all of you on this Friday. We're going to continue the conversation in the pundit pit and talk about how does ABC feel about the president's health care plan. You'll be surprised. We're going to talk about that in 2 minutes. Right back. That could leave a mark. Some startling numbers coming out this morning on media coverage of Obama's health care plan. A Business and Media Institute analysis found that, quote, since Inauguration Day, ABC has aired news stories with positive reviews of Mr. Obama's health care policy 55 times, compared with 18 times when the network highlighted negative reviews. We continue our conversation with the pundit pit and Bill Frist, former senator, not surprising. And then when you look at the fact that we were talking about this a little while ago, apparently ABC employees donated 80 times more money to Obama than John McCain. So what are you going to wind up with in the end?
We do have about 2 months before we may have the biggest, most massive infusion of money, taxpayer dollars, which we don't have, into an entitlement system that's going bankrupt. And we need a debate out there. And I don't know about the ABC and all that, but we need a good debate on the issues. And the debate's not going on in Washington. Sure. People said there's a Burr-Coburn plan, which is a Republican plan out there. Nobody even knows that because of the coverage. It's not going to be settled so much in Washington, but among the American people. And we do need to have balance out there.
But there are so many stories out there. We don't know what's in the bill. And Betsy has actually done some homework. And that's the Kennedy bill, right?
That's right. I've read this bill 3 times, and one conclusion I can reach is that television viewers, you're so worried about their choices, they're going to have a lot more choices than you're going to have when you are compelled by this bill to be in what's called a qualified health plan. And the rude news is that members of Congress are exempted from this bill. The politicians said we want everybody in the United States to have the same broad choices as members of Congress. Not true.
Do you have confidence that the men and women of our Congress will actually read that thing?
Well, that's
they're now famous for not doing that. That's what's really a shame. They're
not going to read it. And if you look in the Wall Street Journal this morning, I've given a section-by-section description, not opinion, description of what's in this bill, and you need to know it, because this bill pushes most Americans into stingy health plans with HMO-like controls over their doctors and over their choices.
But look, this is a beginning, not an end. This is a process that's going to continue for a number of months. And the truth is, according to the Wall Street Journal, not exactly the most liberal bastion, 3/4 of the American people support the basic concept of a public-private plan. 58% have confidence that Obama's going to recommend the right thing. But I think what we need to do in this country is bring doctors, hospitals, the president, and Congress together to work out these issues, and that's exactly what I think is going to happen. And by the way, I think ABC was just trying to counteract Fox's coverage.
But you know, just for a little bit of substance. We've got huge problems in our healthcare system today. We do have about 20 million hardcore uninsured, not 46 million, but who do need some help. We have huge variation. We have costs that are high, but the real problem is they're growing much faster. This is a debate that we do have to have. The time is right, I think, for the debate, but we got to have the debate itself. And the only way to have the debate is take it directly to the American people. Do you fix that cost curve? Do you bend it with the market, or do you bend it with the heavy hand of government?
And it's interesting you say that. Take the debate to the people. It's not going to be on ABC, where we do journalism here. This is what's happening right now. We're hearing from all sides, Betsy.
We can ensure the 24 million or so people who can't afford insurance and really need it, so that they don't lose their home or a lifetime of savings when someone in the family gets sick. We can insure those people without putting government top-down controls written by faceless bureaucrats on all the other Americans who already have health plans they like.
Dr. Frist, before you go, because you are a doctor and a former senator as well, do you have confidence that this... What does your gut say about what would happen?
I think what will happen, because we did it in 2003 with the Medicare Modernization Act, and a lot of people didn't like it, but in truth it had a lot of prevention in it, a lot of means testing in it, will be this. We're going to have two bills that are going to pass before August 1st. There'll be a lot of debate in August. People need to get out and look at what's in these particular bills. The House bill, Senate bill come together. The president will sign a bill. He only needs 50 votes. Will sign a bill that will have much more government involved. It's just how much government is the American people going to tolerate.
Before you go, Doctor, it hurts when I do this.
Yeah, I can fix it. I can fix it. I can fix it.
Dr. Bill Frist, former Senate Majority Leader Betsy McCoy, the former Lieutenant Governor of New York, and Bernard Whitman, former pollster for President Clinton. We thank you all for joining us.
Thanks much.
Thank you. Good to be with you.